Okay, we're going to learn some bones of the lower leg and foot. And you hear me say over and over that if you can learn the names of the bones, it's going to help you a lot with learning other anatomies like ligaments. Okay. I also will point out specific landmarks that I think will help you uh, find bones. And when I'm talking about specific landmarks, especially when you do surface anatomy. So, yeah, we're learning on a skeleton here. It's not even a real skeleton, it's a fake skeleton. Okay. But in everyday life, when we're looking at a person, they are covered with muscles and skin. So if you can find specific landmarks, it'll give you an idea where the bones are. Okay. So let's start off with our shin bone. Our shin bone is actually called the tibia. Okay, it's our main weight bearing bone. Okay, and then on the outside we have what's called the fibula. Okay, it doesn't it's more on the side of the leg, so it really doesn't take on a lot of weight. There's a membrane in between them called the interosseous membrane, and what it does is it diverts 20% of your weight off the tibia onto the fibula. Okay, or we'd wear out our tibia. All the weight would be going through it. So we can divert some weight off to the fibula. Our purpose of our fibula is really muscle attachment and ligament attachment, and then taking 20% off. Okay, so even on the tibia and fibula, there's some landmarks, and this might help you remember that the fibula is laterally. Is that it's fibula has an L in it? It's for laterally. Okay, so as we go down the tibia and we'll go to the medial side on the inside, there'll be a round process. And you'll find these on your ankle. If you feel down on your ankle, you feel these round processes. They have a name there. So this is called the medial malleolus. Okay, it's part of your tibia, but it has its own little name for that region, the medial malleolus. If we follow the fibula down, okay, we'll come to a round process. This is going to be called the lateral malleolus. And you're only going to hear medial and lateral malleoluses when they talk about these regions on the ankle. Otherwise, they just use the word tibia and fibula. Okay. After that, what they do is they divide the foot into three regions. We'll have the back of the foot, this area here. This will be called the rear foot. Okay. Then in the middle is the midfoot, and then you have your toes. This will be called the forefoot. Okay. In the rear foot, there's 7 bones. As a group, they call them tarsals. The midfoot, there's 5 bones. Okay, and they'll call those metatarsals. The word meta means beyond. So we have the tarsals here in the rear foot, okay, but now they went beyond. Now we have the 5 metatarsals. The forefoot made up the phalanges, okay, and each phalange has 3 toes to them, except for our big toe, it only has 2 toes, and they have names, okay. It's pretty easy. You'll figure it out real quick here. Okay, so let's first learn the tarsals. Let's start off with um, this bone right in front. It sits directly underneath the tibia. Okay, you can't really feel it on yourself unless you take your fingers. Here, take your fingers and feel in the front of your ankle. There's a couple grooves that you can stick your fingers in there. And then if you move your foot in and out, you'll feel the talus actually show up. And that's where the talus is. So it's kind of a hidden bone. It's deep in there. So that's where your talus is. Okay. Underneath your talus, then, is this big bone right here. This is the calcaneus. This is your heel bone. Okay, so calcaneus. I'm going to go back to the talus, okay, and I'm going to go on the medial side or the inside of the foot and go along the inside of the foot there, and you'll feel a bone kind of poke out, okay, and that's going to tell you that's the navicular. That portion that fits out is called the tuberosity, and you'll hear the word tubercle anytime that it's a raised area on bone where something's going to attach to it, and most often it's going to be a tendon. Okay, in this case, there's 2 tendons that attach there, a tibialis anterior, and if you have an anterior, you're always going to have the opposite, which would be a posterior. So there's a tibialis posterior. So that's their landmark where they attach. Okay, and that's easy to find because it kind of sticks out. So if you can find your navicular tuberosity bone, okay, through the navicular tuberosity, and move forward 1 finger width, you're going to be on 3 bones called the cuneiforms, okay? So, and they're named, all bones are going to start from medial to lateral. So they'll go, this would be a cuneiform 1, cuneiform 2, cuneiform 3, okay? Last bone of the talus, of the tarsals, is the cuboid. The reason they call it the cuboid, it resembles a cube, okay, kind of shaped like a cube, okay. It's right there. An easy way to find that is, and we're kind of jumping ahead, that these are called metatarsals, okay. And again, they would start from medial lateral, so we'll go, this would be the first metatarsal, second metatarsal, third metatarsal, fourth metatarsal. Then we're on the 5th metatarsal. And you look at this 5th metatarsal, see right here where it flares out, okay? If you can find that it's pretty easy to find on your foot. If you just start at your little toe and slide up, you'll find where this all of a sudden sticks out, okay? Find that and just keep sliding back. As soon as your finger drops off, you're on the cuboid, okay? So I'll go through the tarsals one more time. Talus, calcaneus, navicular, cuneiforms 1, cuneiform 2, cuneiform 3, and then our cuboid, okay? Beyond the tarsals, 5 metatarsals, which I already explained. They go 1, 2, 3, 4, 5. But even the metatarsals have different regions, okay? So all the regions here closest to the metatarsals, or closest to the tarsals, are called base. So let me get this, might be a little bit easier. Let me get a better picture here. Okay, so this would be the base of the first metatarsal. This would be the base of the second metatarsal, base of the third metatarsal, on and on, okay? In the middle, they call them bodies. So base, body, and then at the end, they'll call those heads. So it's base, body, head. On each one, base, body, head, base, body, head, okay? On that first metatarsal at the head, okay, there are 2 floating bones there. And those floating bones are called sesamoids. And those sesamoids actually develop out of a tendon. And there's a muscle with a long tendon right here where the sesamoids are literally growing into. And what they do is they give leverage to your big toe so you can push your big toe down. So as you're running, you can push off on your big toe, okay? So that's the purpose of it, and that's called a sesamoid. There's 2 of them there. We have sesamoids in our thumb too, right about there. That way, that allows you to thumb wrestle real well, okay? To give power. So, and then when I talk about heads, okay, remember it's base, body, head. The heads of the metatarsals, a lot of times you'll hear coaches refer to like, hey, you need to stay on the balls of your feet. Okay, when they say the balls of your feet, they're talking about the heads, the metatarsal heads. Okay, our toes, phalanges. Okay, we actually have 14 bones, individual bones, or 14 toe bones in our foot. We'll start with our big toe. Our big toe only has 2 bones. The rest of them all have 3. Okay, and it's called the hallucis. So our hallucis, they name them as proximal. Proximal, remember, means closest to the center of the body. So proximal, and then a distal, one that's further away. Okay, if you go to the next toe, now there's 3 of them. So now it goes proximal. There's one in the middle, so they call it middle. That's pretty easy. And then distal, same thing. And proximal, middle, distal. Proximal, middle, distal. Even on your little toe, there's 3 bones, proximal, middle, distal. Okay, and those are the bones.